If you're a man over 60 and you've noticed muscle weakness, unexplained fatigue, or an irregular heartbeat, what I'm about to reveal might save your life. Because there's a fruit sitting in your kitchen right now, one that doctors call heart healthy, that could be silently pushing you toward a stroke or even sudden cardiac arrest. And if you're taking blood pressure medication, the danger multiplies by 10. This isn't about moderation or portion control. This is about a hidden biochemical reaction happening inside your body that conventional medicine rarely warns you about until it's too late. Thousands of men end up in emergency rooms every year, never suspecting that their so-called healthy habit was the trigger all along. And the truth behind this will shock you. I'm Dr. Claire Foster, a urologist specializing in men's health with over 15 years of clinical experience. I've helped thousands of patients navigate the complex interactions between medications, diet, and cardiovascular health. What I've learned over these years is that there's a dangerous gap between what's marketed as healthy and what's actually safe for men with certain medical conditions. Today, I'm going to share something that conventional medicine often ignores because it doesn't fit neatly into standard nutritional guidelines. But understanding this could be the difference between a long, vital life and a devastating health crisis. Here's what most men don't realize. When you ignore this problem, you're not just risking discomfort or mild symptoms. You're putting yourself on a path toward hyperkalemia, a condition where potassium builds up in your bloodstream to dangerous levels. Your heart relies on precise electrical signals to beat in rhythm. Too much potassium disrupts these signals, causing irregular heartbeats, chest pain, and in severe cases, complete cardiac arrest. Imagine feeling perfectly fine one moment, then suddenly experiencing palpitations so severe you can't catch your breath. Your muscles grow weak, your chest tightens, and confusion sets in. Studies show that up to 10% of hospitalized patients experience this condition, and in men with chronic kidney disease, that number jumps to 40%. But here's the part that frustrates me most. The medical community has convinced millions of men that potassium-rich foods are always beneficial. They're not wrong for most people, but if you're taking certain blood pressure medications, or if your kidneys aren't functioning at full capacity, this advice could be lethal. The loss isn't just about quality of life. It's about survival. It's about being there for your grandchildren. It's about maintaining your independence and strength. And the belief that it's just normal aging is the most dangerous myth of all. Because this isn't aging, this is a preventable biochemical crisis. But I promise you this. By the end of this video, you'll understand exactly what's happening in your body and what you can do about it. As we get ready for the big reveal, tell me in the comments which city you're watching from. I love to see how far our health community reaches. Now, let's talk about the 3 silent dangers that turn a healthy fruit into a potential threat. The first item on our list is something that 85% of men over 60 consume regularly, often on doctor's orders. And that's precisely where the danger lies. We're talking about the combination of ACE inhibitor medications and high-potassium foods like bananas. Let me tell you about Charles, a 67-year-old retired engineer from Ohio. Charles came to my office complaining of persistent muscle weakness and episodes of dizziness. "Doc, I've been doing everything right," he told me. "I take my blood pressure pills every morning. I switch to a healthy diet with lots of fruits. I eat 2 bananas every day because I read they're good for my heart." When I ran his blood work, his potassium levels were at 6.2 milliequivalents per liter. Normal range is 3.5 to 5.0. Charles was in the danger zone. At first, he was skeptical. "But bananas are supposed to lower blood pressure," he protested. I explained that while that's true for most people, his medication, lisinopril, an ACE inhibitor, was changing the rules of the game. Within 2 weeks of adjusting his diet and medication protocol, Charles's potassium levels normalized. "I can't believe something so simple was putting me at risk," he said at his follow-up. "I feel like I got my strength back." Here's the science in simple terms. Think of your kidneys as a sophisticated filtration system. They regulate potassium levels by removing excess through urine. Now, your body also produces a hormone called aldosterone, which tells your kidneys to excrete potassium while holding on to sodium. It's a delicate balance. ACE inhibitors work by reducing the production of angiotensin II, which in turn decreases aldosterone production. With less aldosterone, your kidneys don't excrete potassium as efficiently. It starts accumulating in your bloodstream. Now add a banana to the equation. One medium banana contained about 420 milligrams of potassium. For a healthy person with normal kidney function, this is beneficial. But for someone on ACE inhibitors or similar medications like ARBs, the potassium has nowhere to go. It builds up, and that's when the electrical system in your heart starts misfiring. Research from JAMA Internal Medicine found that 11% of outpatients using ACE inhibitors developed hyperkalemia, with the highest risk in men with elevated creatinine levels and those over 70 years old. So what's the practical protocol? First, if you're taking an ACE inhibitor like lisinopril, enalapril, or ramipril, or an ARB like losartan or valsartan, you need to have a conversation with your doctor about your potassium intake. Don't eliminate potassium entirely, that's dangerous too. But limit high potassium foods to 1 serving per day maximum. Instead of 2 bananas, have half of one. Better yet, rotate your fruits. Choose apples, berries, or grapes, which have significantly less potassium. Get your potassium levels checked every 3 to 6 months, and absolutely avoid potassium supplements or salt substitutes, which often contain potassium chloride. These are the silent killers that patients don't think twice about. And if you found that revealing, wait until you hear about our second item as it affects the body in an even quieter way. The second danger is something that makes the first problem exponentially worse: impaired kidney function. Meet Robert, a 72-year-old retired teacher from Texas. Robert had been managing his high blood pressure for years with medication. He also had type 2 diabetes, which he controlled reasonably well. But what Robert didn't know was that his kidneys were operating at only 45% capacity. "I felt fine," he told me. "I had no idea anything was wrong with my kidneys." Robert was eating his daily banana, taking his losartan, and unknowingly creating a perfect storm. When he came to the emergency room with severe chest pain and an irregular heartbeat, his potassium level was 7.1. That's critically high. "The ER doctor told me I was hours away from cardiac arrest," Robert said, "all because of a banana and medication I thought were helping me." Here's what's happening at the cellular level. Your kidneys are made up of millions of tiny filters called nephrons. In chronic kidney disease, these nephrons become damaged and stop working efficiently. Even if you're not in kidney failure, reduced function means reduced potassium excretion. Now layer on a medication that further blocks potassium excretion, and you've created a biochemical bottleneck. It's basically as if you have a sink with a partially clogged drain and you keep running the water at full force. Eventually, it overflows. The same thing happens with potassium in your bloodstream. Studies show that in patients with stage 3 or 4 chronic kidney disease, taking ACE inhibitors or ARBs, the prevalence of hyperkalemia can reach 17 to 40%. And here's the frightening part. Chronic kidney disease often has no symptoms until it's advanced. You could have 50% kidney function loss and feel completely normal. The practical application here is critical. Every man over 60 taking blood pressure medication should have their kidney function tested annually, at minimum. Ask your doctor for a comprehensive metabolic panel that includes creatinine and estimated glomerular filtration rate, or EGR. Your EGR tells you what percentage of kidney function you have left. Normal is above 90. If you're below 60, you have chronic kidney disease, and you need to be extremely careful with potassium intake. If you have diabetes or heart failure, get tested every 6 months. Track your numbers. And if your kidney function is declining, work with a nephrologist or renal dietitian to create a safe eating plan. This isn't something you can guess at. The stakes are too high. What worries you most today? Type 1 in the comments if it's the medication interactions we've discussed, or 2 if it's kidney function concerns. Your answer helps me create future content. Now for the third silent danger, and this one catches even the most health-conscious men off guard: potassium-sparing diuretics and other hidden sources of potassium. Let me introduce you to Michael, a 68-year-old veteran from Florida. Michael was the picture of proactive health management. He took his ACE inhibitor for blood pressure, his metformin for diabetes, and his doctor had recently added a diuretic to help with mild fluid retention. "I thought I was doing everything right," Michael told me. "I even started taking a Dingley multivitamin to cover all my nutritional bases." What Michael didn't realize was that his new diuretic, spironolactone, was a potassium-sparing type. Unlike regular diuretics that flush out potassium, this one retained it. Combined with his ACE inhibitor, his daily banana, and a multivitamin containing potassium, Michael's levels spiked to 6.8. "I started feeling weak, confused, and my heart was racing," he said. "I actually thought I was having a heart attack." After we adjusted his medications and educated him about hidden potassium sources, Michael made a full recovery. "I never thought vitamins could be dangerous," he said. "Now I read every label." Here's the explanation that every man needs to understand. There are two types of diuretics. Loop diuretics and thiazide diuretics actually lower potassium levels, which can be problematic in its own way. But potassium-sparing diuretics like spironolactone, amiloride, and triamterene do the opposite. They prevent potassium loss. Doctors prescribe these for specific conditions, particularly when patients have had problems with low potassium in the past. The problem emerges when you combine these with ACE inhibitors or ARBs and then add dietary potassium on top. It's a triple threat. Think of it like this. You have 3 faucets filling a bathtub, your medication is blocking the drain, and you're wondering why the water level keeps rising. But here's where it gets even trickier. Many over-the-counter products contain potassium. Salt substitutes marketed to people with high blood pressure often use potassium chloride instead of sodium chloride. 1 teaspoon can contain 600 to 800 milligrams of potassium. Multivitamins can contain up to 99 milligrams per serving. Some protein powders and sports drinks are loaded with it. Even certain pain relievers, particularly NSAIDs like ibuprofen, can interfere with potassium regulation and increase levels. Here's your action protocol. Make a complete list of every medication, supplement, and over-the-counter product you take regularly. Bring this list to your doctor or pharmacist and specifically ask about potassium interactions. If you're on a potassium-sparing diuretic, you need to be especially vigilant about dietary sources. Avoid salt substitutes entirely. Read nutrition labels on packaged foods. Look for potassium content, not just sodium. Foods marketed as heart-healthy often have added potassium. If you're taking NSAIDs regularly for arthritis or pain, discuss alternatives with your doctor. Acetaminophen doesn't carry the same potassium risk. And remember, natural doesn't mean safe. Just because something comes from a health food store doesn't mean it won't interact with your medications. So to recap, the 3 silent villains are: Number 1, the combination of ACE inhibitors or ARBs with high potassium foods like bananas, which can cause dangerous accumulation in your bloodstream. Number 2, impaired kidney function, which dramatically reduces your body's ability to excrete potassium and multiplies the risk. And number 3, potassium-sparing diuretics and hidden sources of potassium in supplements and processed foods that create a perfect storm. The good news is that with proper monitoring and smart dietary choices, you can avoid these dangers completely. Consistency in testing and awareness of what you're putting in your body are your strongest defenses. Now I want you to understand something crucial. Your body hasn't forgotten how to be healthy. It just needs your command. You have the power to take control of this situation right now, today. Knowledge is only valuable when it leads to action. Check your medication list, call your doctor on Monday and request a comprehensive metabolic panel. Ask about your EGFR. Review your potassium intake honestly. These simple steps could literally save your life. I've seen too many men in emergency rooms who wish they had known this information sooner. But I've also seen countless men like Charles, Robert, and Michael who made simple changes and reclaimed their strength, their confidence, and their peace of mind. You can be one of them. The choice is yours. Don't let a fruit bowl be your downfall. Be informed, be proactive, be strong. If this information was valuable to you, please hit the like button so YouTube will show it to more men who need it. And don't forget to leave a comment. I personally read as many as I can. Share this video with a friend or family member who you know will benefit, especially if they're on blood pressure medication. And of course, subscribe to the channel so you don't miss any health guides. And one last thing, a personal request. I recorded this video wearing a mask. It was really important for me to know if the sound quality was good and if you could understand me perfectly. Please leave a quick comment about it. Your feedback is crucial for me to keep improving. A big hug, and I'll see you in the next video.